Good morning, everyone. I'm Kayla Wright. I am giving the youth perspective. I'm 25 years old, so I think I'm still there. Uh, and as Dr. Connell said, I am the programs coordinator at the Jamaica Youth Advocacy Network. And I wanted to start off this testimony by saying what nutrition advocacy means to me because it is deeply personal. I grew up loving my Uncle Errol's cooking. He's an incredible chef. And I love my mother's cooking, but nobody to my uncle. And he's hypertensive and also has diabetes. And as a child, seeing someone you love grapple with these realities is very hard. Over time, I realized, though, that my family situation isn't unique because 1 in 3 Jamaicans is hypertensive, 1 in 8 is diabetic. And these aren't just numbers, they're families, they're communities, they're us and people we love and care about. So through my journey in nutrition advocacy, I've learned that NCDs are the leading cause of death in Jamaica and across the Caribbean. And this is why I feel compelled to play my part in shaping a Caribbean where health is valued over profit, where consumers have clear information about what they're putting in their bodies, and where the healthier choice is the easier choice. As young people, we're targeted by aggressive marketing of unhealthy foods and sugary drinks and alcohol, even tobacco, and the habits formed in our teens and early 20s set the tone for the rest of our lives, believe it or not. And it's true. And if we don't have early intervention, we're essentially watching a new generation inherit the same NCD burdens that we're seeing today. So I think it's very safe to say that I represent a generation that wants to live long, healthy lives, free from preventable diseases. Climate change is another thing, but that's for another time. But this requires action now, from policy change to strong community initiatives to legal reform, because we're not just future leaders. And I think I've grown a bit annoyed at that saying, because we're here today, we're ready today to create and co-create solutions. And I think, as Diana had said earlier, and I'm remembering just now, we shouldn't just be invited to speak occasionally, but hold permanent positions in the decision-making process. So the political declaration is an important step, and I think we can welcome the emphasis on mental health and regulations of unhealthy marketing. But truthfully, there's still gaps, especially when it comes to youth engagement, because we cannot just be consulted at the end. Young people need a seat at the decision-making table, otherwise it's just tokenistic, and not only as advocates that are just nagging in people's ears, but as partners who shape and design and monitor policies that affect us, because NCD prevention begins with us. So I do welcome the inclusion of, I think we as youth can welcome the inclusion of strong regulations for marketing, because for far too long, the food industry has aggressively, I'm using that word aggressively, promoted sugary and ultra-processed products to children specifically. And this shapes their preferences before they can even read labels. And this is very unfair, and it's definitely unhealthy. And shameless plug, I co-wrote a letter to the editor calling out manufacturers as beauty bearers, because we always say it takes a village to raise a child, and that village has to include manufacturers, whether they like it or not. So we do need to push for policies that protect children and empower families, from front of package warning labels to even restricting the advertising of unhealthy foods, because healthy environments must become the default and not the exception. I want to say, as we reflect on the progress since the Port of Spain Declaration back in 2007, I was 7 years old then, and we look ahead to the high-level meeting, I want us to ask ourselves what kind of Caribbean, or what kind of CARICOM we even want for the next generation. I personally want a Caribbean where health is the priority, where we're living free from preventable diseases, where our children are growing up strong and well-nourished, and where young people, like me, are not just voices in the background, but leaders of change. So And it has been repeated earlier, I think, that we must bring in everybody to deal with the issue, and that definitely includes you.
It is time for CARICOM to lead again.